All right, on we go to foreign body removal. Two codes to choose from, simple and complicated. Again, with the simple and complicated. So we have the 10120, which is for simple, and then 10121 for complicated. Running into this whole issue of simple versus complicated once again. Simple foreign body removal, that lay description for that code states incision in the skin overlying the foreign body, and the foreign body is retrieved using hemostats or some other kind of tool. That would be fine. Anyway, sutures are included in that. So if you're looking at complicated, this 10121 documentation is going to be key. What made this more complicated than that simple incision and removal description that I just read? So it's important to be looking for those details to indicate to you why this was more complicated. You'll want that documentation to support any kind of reimbursement issues, and you want to make sure it stands up to audits or reviews. Some other foreign body removal tips on the right-hand side of the screen. These codes do require an incision per the description. All right, so our example, we see this a lot. There's a foreign body embedded somewhere in the skin. A little bit of it is sticking out, and the provider grasps it and carefully removes it. Unfortunately, there was no incision made there, so we can't code an incision and removal. All right, so that'll just be part of the E&M. Removal of sutures does not qualify for this code. And then also, when we're talking about deeper layers of tissue, and you might have noticed a theme with any of these, right? If it's deeper, you're going to a different section of the CPT book, the musculoskeletal section. So we're talking about those really deep foreign bodies. Go ahead, head to the musculoskeletal section of the book and use those codes. So the example given here, we have a wood chip that's embedded in the deeper fascial tissues of the upper arm. And you'll go to that section, you'll pick out one of these codes, maybe it's a 24200, maybe it's a 24201, but just be having a heads up on that.